Scientists have discovered a skeleton from 31,000 years ago. Years where are traces of leg amputation. In the oYZD0 cave in the Indonesian part of the island of Borneo, in the site of some of the earliest rock art around the world, scientists have discovered the remains of a young person showing traces of leg amputation. The skeleton is 31,000 years old. Which means that researchers they found the world's oldest example of amputation, without modern ones, antibiotics and painkillers. Scientists have found the earliest example of leg amputation, tens of thousands of years before the advent of modern tools, surgery, antibiotics, and painkillers. Skeleton of a young person bearing clear signs of amputation of the lower leg was discovered on the island of Borneo. Scientists they claim that the patient survived another 6 to 9 years after surgery. According to research published in the journal Nature, prehistoric surgery shows that people have made progress in medicine much earlier than previously thought. Scientists from Griffith University in Australia came across remains of a young person in 2020 while examining the oYZD0 cave on the island Borneo, which is located in a rainforest region known for the earliest examples of rock art in the world. The discovered skeleton was intact, however, it lacked the left foot and lower left leg. By examining the remains, the researchers concluded that the missing elements did not lost in grave nor lost in accident have been carefully removed. The remaining bones of the left leg show signs of a careful, oblique one incisions that have healed. There were no traces of the infection you should have expected if the lower leg was even bitten off by a large one predator. There were also no signs of a fracture or crush that could be broken except if the young individual suffers damage to health as a result of an accident. According to researchers, everything indicates that this person still lived for about 6 to 9 years after cutting off the limb, eventually dying from unknown causes as a young adult. This find suggests that the prehistoric inhabitants of Borneo they knew enough about medicine to perform amputation without leading to death, blood loss, or infection. Unfortunately, scientists in research they did not determine exactly what tool the ancient surgeon used amputation of the limb or how it prevented infection. However, they speculate that the cut could be made with a sharp stone tool. They point also for some of the plants found in the region that have properties medicinal and could be used to prevent infection. But that's not all. The community had to care for the young patient for many years because surviving in difficult amputee terrain was certainly not easy. A huge surprise was that this ancient patient he survived a very serious and life-threatening surgery as a child that injured him. It healed to form a stump, and that for years it lived in mountainous terrain with limited mobility, suggesting a high degree of care in the community in which he lived, says Melandri Vlock from the University of Sydney. Tim Maloney from Griffith University emphasized that the early one operation rewrites the history of human medical knowledge and development. So far, the earliest example of amputation has been found in France's skeleton of an elderly man who had his left forearm removed just above his elbow 7,000 years ago. Even today, when doctors have a whole arsenal up their sleeve medical products that are intended to prevent infections, inhibit bleeding and pain, amputations require significant technical skills and fitness manual. So far, scientists thought advanced practices medical developed about 10,000 years ago. Years ago, when people settled in agricultural societies. But this find can be added to a growing number evidence that people began to take care of their health much earlier in your history. Maloney and colleagues admit the discovery disproves the dominant assumption among archaeologists is that more complex operations were beyond the possibilities of nomadic societies. The authors of the publication admit that an ancient surgeon or team doctors had to have detailed knowledge of human anatomy and hygiene and the circulatory system to be able to efficiently move among veins, vessels, blood and nerves, amputate the foot and prevent blood loss and infection. But above all, these people must have known that this young person there was an urgent need to remove the lower leg so that it could continue to live. A new discovery in Borneo shows that people were already able to effectively amputate diseased or damaged limbs long before this. How we started farming and living in permanent settlements, says archaeologist Maxime Aubert of Griffith University. Determining the age of the remains can be difficult. In this case, scientists dated the skeleton by measuring trace levels of preserved radiation in tooth enamel, which gave them an age estimate consistent with dating results radiocarbon sediments where the remains were buried. The dating results show that this person died between 31,201 and 30,714 years ago at the age of about 19 to 20. Researchers were unable to determine the sex of the remains, but their height was similar to the growth of male individuals known to have lived at this time and at this time place. It is not known whether the ancient inhabitants of Borneo owned advanced medical skills. Perhaps the discovery represents an isolated and rare case. However, the rich knowledge that indigenous communities usually have about plants with medicinal properties growing near them places of residence suggest that ancient people from these rainforests they knew how to effectively treat infections. But their knowledge could have gone deeper. One possibility is that the rapid rate of infection in the hot and humid tropics prompted early foragers in this region to take advantage of natural pharmacy medicinal plants in the rainforest. It led to an early boom in the use of forest resources to produce anesthetics and antiseptics, says India Ella Dilks Hall from the University of Western Australia. All previous archaeological cases involving advanced surgical procedures were associated with large, sedentary surgery agricultural communities, ancient Egyptians, Peruvians, etc. Surviving amputation is the latest medical norm for most Western people societies where antiseptics developed at the end of the 19th century age. This was the first major step towards amputating, often at this time carried out by hairdressers, emphasizes Maloney. Different colored hair from birth? What is poliosis? Poliosis is a characteristic condition. Reveals a white or gray band on the hair, often around the forehead, but may affect also other parts of the body. This condition may occur from birth and is associated there is a pigment called melanin missing in the hair follicles. Although alone the loss of dye is not dangerous, it is poliosis that is associated with various other medical problems, and some of them can be very serious. Poliosis, or melanin loss in hair follicles, it usually affects the head, most often around the forehead, but it may also appear on eyebrows or eyelashes and in other hairy parts of the body and affect surrounding skin. Therefore, this condition is very easy to notice. White or gray highlights are clearly distinguished from natural hair color. Changes in pigmentation may appear at one point on the head or be disseminated throughout its entire area. Poliosis is a rare disorder. There is no difference in frequency occurrence between men and women or between ethnic groups, but the disease is more visible and noticeable in people with darker skin. It can appear suddenly at any age. It is also possible that this condition will occur from birth. Scientists don't know for sure what are the causes of the disorder and what mechanisms interact here, but with poliosis has been linked to various diseases, often dangerous ones. It is also known that genetic factors may play an important role in this condition. As previously mentioned, poliosis has caused no or limited occurrence of melanin in hair follicles. Melanin it is a pigment that dictates the color of the skin, eyes, hair in humans, and animals' furs. When it comes to people, the amount and type of melanin molecules depend on hair color. For example, in people with blonde hair there are few of these ingredients. The melanin molecules have a spiral structure. The lack of dye in part of the hair is not dangerous, however it often happens that this is a condition that appears with many dangerous diseases. Poliosis may develop due to genetic conditions. May accompany tuberous sclerosis or Waardenburg syndrome type 2. It may appear along with autoimmune diseases such as vitiligo. It may also occur as hair regrowth in alopecia areata and in conditions such as disease Vogt-Koyanagi Harada in Alexandrini syndrome and in combination with cancer, as a result of the use of certain drugs or in case of inflammation. Therefore, as soon as we notice the symptoms, it is best to see a doctor. Currently, it is impossible to permanently change the shade of your hair changed as a result of poliosis. Of course, you can dye your hair knobs affected by the change or take advantage of aesthetic medicine treatments. However, not everyone wants to hide the disease. Some people treat it as an asset, originally improving beauty.